All right. Hello, everyone. If you are here for the GeneSight Mental Health America Happier Holidays webinar, you are in the right place. We are going to give everyone a minute or so to trickle in. If you are interested, we would love to hear from you and know where you are logging in from. So feel free to put that in the chat and so we can kind of see where we're getting representation across the country. But we'll just give about 1 minute for everyone to log on and then we'll go ahead and get started. Colorado, love it. Thank you for that.
Mhm.
And I should have mentioned, please put them in the Q&A. Sorry, not the chat feature. Too many technological options. All right. We are at 1:02. I would love to be respectful of everyone's time, so we will go ahead and get started. Thank you so much for being here today. As I mentioned, if you are here for the GeneSight Mental Health America Happier Holidays webinar, you are at the right place. So we're going to start with a brief introduction, get to know your panelists, get to know why we're here, and then we'll dive right in. We know that for some, holidays can be a time of fun, joy, and family. And for others, can be a source of enormous stress and often have a negative impact on our mental health. So many of the upcoming expectations of the holidays could put a strain on anyone. Good afternoon. My name is Rachel Earls. I'm a member of the GeneSight medical team, and I'm going to be your moderator this afternoon. Briefly, the GeneSight test is a genetic test that provides information on how your genes may affect your likelihood of response, risk of side effects, or metabolism, or how you break down medications that are used to treat depression, anxiety, ADHD, and other mental health disorders. Today, we have an amazing panel of clinicians who will share their tips and tactics for how they help their patients have a general happier holiday, how GeneSight may help provide information to clinicians about medication management, and how to head into the new year with a better handle on mental health. So I will start by introducing our esteemed panel. First, Dr. Robin Miller is the owner and medical director of Triune Integrative Medicine in Medford, Oregon. Robin is a board certified in internal medicine, fellowship trained in integrative medicine, and a member of the Oregon Medical Association. She's an award-winning medical reporter and is widely published. Her books include Invisible or Invincible, Your Choice, Heal Now, Time to Unsick Yourself with a 21st Century Guide to Wellness, and The Smart Woman's Guide to Midlife and Beyond, a no-nonsense approach to staying healthy after 50. Thank you for being here, Robin. We're so lucky to have you today.
Thanks for having me.
I also want to introduce Dr. Whitney Brown. Whitney is a dual board certified nurse practitioner in family practice and psychiatric mental health, a clinical assistant professor at Samford University, and the owner of Ivy Leaf Health and Wellness. She practices in both inpatient and outpatient settings, serving a plethora of populations, and is the author of numerous peer-reviewed publications nationally and internationally. Great to see you, Whitney. Whitney, we couldn't hear you then, but I could see what you were saying. So just maybe to adjust the mic there a little bit. We also have Elizabeth Johnson, who is an advanced practice registered nurse at the Center for Healing Arts and Wellness Services at the Women's Hospital in Evansville, Indiana. She specializes in perinatal mental health, working with women and partners who are struggling mentally and emotionally while navigating fertility, pregnancy, and trauma associated with pregnancy and postpartum mood and anxiety disorders. Welcome, Elizabeth.
Thank you.
And last but certainly not least, we have Dr. Lynn Bufka. Lynn is a board-certified licensed clinical psychologist with particular expertise in the treatment of anxiety. She serves as the Associate Chief for Practice Transformation for the American Psychological Association. Lynn has spoken on stress and mind-body health matters for multiple media outlets and has also been interviewed regularly as an expert on APA's annual Stress in America survey. Thank you for being here today, Lynn.
Delighted to be here with everyone.
And just a kind of a call to action here. So for the participants on the webinar, if you have questions, please ask them, but we ask that you put them in the Q&A section. All right, so we will go ahead and dive in here with some questions. The first question, I'm going to start with Robin, and if anyone else, please chime in. What stressors do you see individuals facing during the holiday season that may lead to increased mental health concerns or inpatient visits?
There are so many. uh, Financial, money, interpersonal relationships. COVID still looms large. People with long COVID, worrying about COVID. At this time of year, loss is a big one, a big stressor, missing people that are gone who have died. In our area, 3 years ago, we had a horrible fire that wiped out an entire town. People are still dealing with that. And it's particularly hard around the holidays. And then, of course, you have what's happening globally, which is upsetting everyone, and I'm sure triggering quite a few people. So there is a ton of things out there that are stressing people out and really affecting them.
Thank you. Does anyone else have any other comments on that? Maybe anything different that they see with their patients?
Well, another factor that is stressing many people out, and we see this, no matter what we ask, when we ask the question, anything related to money and economy is a huge source of stress for respondents to our surveys. And this time of year in particular, it's a significant stressor because for many people, it feels that there are expectations to perhaps spend more. If you haven't been able to or haven't tried to budget for the holidays, there's particular stressors then about spending money and activities and things like that. So it's certainly where money is a point of concern in a particular way at this time of year for many individuals.
Elizabeth, do you want to speak to the comment on expectations, maybe in your patient population, and how that can be affected during the holidays as well?
Well, I think it's ironic that this time of year, everything we tend to say is either happy holidays or Merry Christmas. And the vast reality is, honestly, many people are anything but holly and jolly this time of year. So there's a little irony in what the season culturally is supposed to represent and where so many people are finding their headspace, their soul space, and where their spirit is mentally and emotionally. And although I think it's important to normalize that sometimes life can be like a slinky, we have some ups and downs, and we have the ebb and flow of stressors, but sometimes it almost starts to feel and look like a ping pong ball where the lows have gotten really low. And the sadness, it's not crying over spilled milk, it's a meltdown over spilled milk. And so I think the first thing is that we realize and identify is that the season and the holidays is sometimes gasoline on the fire that's already been burning the other 9 months of the year.
Sure.
And the facade that we kind of want to put on in the face of the holidays gets exhausting. Gets really, really exhausting. And the question being, well, how does this sometimes look? What do the signs and symptoms look like in our patients and in people? And that varies, just like we all have a different face. The face of anxiety or depression, loneliness, grief, anger, hurts and wounds absolutely are going to have different presentations and feelings and look differently. But the point being is when that ping pong ball starts to really kind of move erratically and those lows are really low or maybe lasting day after day, and you're seeing the symptoms are more prolonged or more severe, those are those red flags to say, hey, I've gone from this to this, and it's time to have a conversation about not being okay and getting some support.
That is so insightful. Thank you. And I think it lends itself nicely to some of the comments that we're seeing for other reasons why individuals feel stressed out during the holidays. One of them is just being general health issues that may be exacerbated during the holidays. This lends nicely to the next question of, we can start with Elizabeth on this one and kind of work our way around, but how do you see seasonal affective disorder impact individuals during the holidays and throughout the winter season? And maybe define seasonal affective disorder if you don't mind as well.
Well, seasonally, there's a lot of, we talked about the new, the amplified types of triggers that are occurring this time of year. be it the person that's already financially figuring out, is struggling to pay their mortgage. Now they're trying to figure out how am I going to play Santa for my 3 kids? So I think that for many people, it's an amplification of symptoms that may already be brewing and already present. And as I said, those symptoms may vary person to person, but the holidays certainly have a way of shining and not a pretty Christmas light on some of those symptoms. And the parameters that I encourage when I see somebody that says, how do I know when to get help? When is it time? Because life is stressful, right? Who isn't stressed? Everybody's stressed. Everybody's stressed. You just have to drive down a busy street and you're going to see stressed people just in their driving. And that's where I kind of go back to the thought of how severe those symptoms may be getting, how often are they occurring, how long do they last? What are those things that maybe you've been trying to do that are helping, or those things that you haven't been doing that maybe you should start trying that you know help you? What role potentially does talking to a healthcare provider, discussing treatment options, be it medications or other treatment modalities to help you? Those are the things that I would encourage that person to really say, hey, it's kind of like being in a wrestling match with my emotions, uncle. It's time to call uncle. It's time to give. It's time to do something about it.
Sure. Thank you. Any other comments?
Yeah, seasonal affective disorder is something that happens to people, many people, when the light starts to change. So you often see people start to get depressed as early as August. And so they can often be helped by light boxes and knowing that that's a trigger for them to become depressed. So one of the things that I see are people that don't realize it happens earlier than they thought.
Yes.
So usually you see it around August.
Yeah.
So if that's something you notice you're starting to get blue around that time, then you can talk to your provider about help. Sometimes a light box is all you need, and they have good ones at Costco, by the way. So it's and I don't work for them, but it's something to think about.
I agree, Robin. One thing that I've told patients to do along a similar thought is to even put some of the lights in their home on a timer. So when you're coming home from that stressful day, you're not walking into darkness and then all you want to do is put on your PJs and crawl into bed at 5 o'clock at night. Walk into a bright, cheery space and have that maybe already waiting for you when you get home, or put that light box on that desk or on that nightstand where you like to spend some time. That's an excellent point.
Whitney, I can't hear you. Are you guys able to hear Whitney?
No.
Okay, we'll circle back to you, Whitney. Lynn, did you have anything to add?
I think the light box, I've seen the impact of the light box for people so significant. So really, if you're aware of that as a potential pattern for you or somebody you care about, definitely think about the light box. If a light box doesn't seem feasible, take advantage of the sun. Get outside. There's so many benefits to being outside. I mean, use proper skin protection, but there are so many benefits for being outside in addition to sunlight, and what we can get from that. But just by being outside, we're also likely having some activity too, which is very beneficial for all of us any time of the year, but particularly a time of year when extra treats and goodies are around, and sort of maintaining our balance of our activity and our nutrition is always a good idea. And I think this is a particular concern, having lived in both Massachusetts and Michigan. It is a particular concern in places where there's less sun. So really think about that as a potential factor that can impact how you are experiencing your life, and plan for it. We can definitely take better care of ourselves when we're more aware of what tends to make our life a little more challenging, and plan for it so that we can be proactive in trying to do things differently.
That's really helpful. The next question kind of ties into that perfectly. So obviously we've talked about how the holidays can be stressful for different reasons for different people on different walks of life, but what do you suggest outside of seeing a healthcare provider that patients can do for themselves and their mental health during this time? You just mentioned numerous things, Lynn, but any other suggestions that are critical during this holiday period to kind of keep you in check?
I think that there are so many things that we can do to take care of ourselves. And this is, it's never the wrong time to try to establish a good, healthy habit. So pay attention to what's happening, how you do. Are you consistently taking prescribed medications as directed? Are you trying to think about what you're eating and putting in your body and getting adequate hydration? Exercise, meditation is great. Turning off the news and social media, that social media should be a tool that is helpful and beneficial to you, not something that you feel driven by. So those are just sort of the basic foundation that we always try to do. But at this time of year, particularly important to try to manage your expectations. I know somebody else talked about that already. Think about what you value most about this time of year and try to behave and plan in ways that align with your values. So if spending time with your family is what's most valuable to you, focus on that. If there are things that you want to do with children that are particularly important to you, focus on that. And I think all of us experience great benefit. Well, I know we do, and the data supports us on that. As a scientist, I have to say that, from gratitude and small acts of kindness. Those can have significant benefit, not only for ourselves, but also for the community that we're in.
Thank
So
you.
when I see people getting stressed out, especially around now with so many good things to eat, what they do is they usually reach for the cookies, the donuts, and then sit on the couch. And that's absolutely not a good thing to do because it makes things worse. What people may not realize is the microbiome, your gut, is what makes serotonin, the happy hormone. And so when you eat foods that are not good, then the microbiome is depressed, and so are you. So one of the things to do when you're feeling stressed out is really, as Lynn said, walk outside, hang out with nature, with your friends, eat healthy foods, exercise. Just taking a walk is good and it'll make you feel better. And yes, do random acts of kindness. It makes you feel better and is actually better for the giver than the receiver when they look at it in terms of studies. So there are many things you can do which may not make sense to you because what you do want to do is eat that cookie, but don't. Eat something healthy, take a walk.
Whitney, do you have anything to add here?
Can you hear me?
I can. There we go.
Wonderful. Yes, I did want to just add that this is also a good time to consider if you work in an office space and your office space doesn't have windows, to make an appointment with your primary care provider as well, because this could also be implications of low vitamin D levels. So those are things to take into consideration, and those of African American descent are at higher risk for lower vitamin D levels, which can mimic depression or seasonal affective disorder. So those are some things to consider. So even if you don't feel that it's a mental health issue per se, it may be a medical health issue. So take that into consideration and schedule a follow-up appointment with your primary care or your mental health provider or both.
That's wonderful advice. We got a question in the audience about any suggestions to make the holidays less stressful for children or to help with children?
Those who I was just, for those who didn't see, I posted the chat, it's a great time of year. It's very exciting, but still try to keep children on their regular routines. They benefit from that so much. So as tempting as it might be to let children stay up late many nights, it's not always a great idea. So try to keep them on regular routines in terms of sleep, food, nutrition, activity, all those kinds of things. But just as the things that we might want to do as adults, focus on gratitude, small acts of kindness, we can teach children to do those things as well, so that it becomes something that they value and see as part of the joy at a time of year that we hope is joyous for everyone, but may not be. And that was a little bit of a way for children to learn to spread joy in what they do. But I know Whitney was about to say something too, so I'm sure there's great ideas from everyone.
And I was just going to add to what you said. Children like managing their expectations. They like to know what's coming next. So that gives you the opportunity as a parent to just kind of reinforce and manage those things. This is the time of year that we give back, or this is the time of year that we're going to spend X amount of time doing whatever that is, so that you can kind of give that structure to your day, but also not necessarily taking anything away. And children like boundaries. So it's okay to do that. It's okay to tell them up front, and also to decrease your stress level as well as theirs.
Whitney, you tied exactly into something I was going to say, is when you see that anxiety in your child, a question you need to ask yourself is, are they looking in the mirror, my mirror? And so a little self-reflection when you see that little kiddo with angst is to say, is there something within our home, within me, that is exhibiting some of these symptoms as well? So sometimes we have to start with that self-reflection and that self-assessment to go, oh man, I've been short fused. My to-do list is so long and I just feel overwhelmed. And that little kiddo is kind of feeding off of that angst. And there's a lot to be said for doing less and being okay doing less. And that somebody else brought up the concern of social media and the snapshots of the glamorous decor and we do a different elf on the shelf every single day, and it just adds and adds and adds. And I brought up exhaustion once before. Some anxiety, the symptom of it is just exhaustion. And so then our children display exactly what they're seeing in us.
That is so true, Elizabeth. I also think that this is an opportunity to focus, I believe that Lynn said as well, to focus on gratitude. And this is an opportunity to do something that I've been recommending to my patients during this time, which is called creating a gratitude box. This does not mean that you necessarily have to go out and make a purchase. This can be a shoe box or an Amazon box, and you can wrap it or decorate it however you want. But what you're putting inside the box is essentially concepts of thought that make the cup half full, appreciating the things that you have. So these can be anywhere from quotes that are positive, scents, smells, anything like that that reminds you of the positive things in your life. These can be photos, different colors, textures, but things such as books, and they highlight the memories, because a lot of times people are highlighting the negative memories or the loss per se of a loved one. So this is an opportunity to kind of redirect that and restructure that. And, we know that higher positivity levels and increased empathy happen when we consider gratitude. And I think this is a great opportunity to also do this for your children.
That's wonderful advice. Thank you all. I think we've hit on this a couple of times now, that the holidays are this unique time where, even though everyone's path is very different, everyone's journey looks very different, we're all expected to have the same outcome of gifts and happiness and family time, but not everyone's walk of life is amenable to that. And so I think it lends itself to a question that was asked in the chat about how can we look at holidays when people are suffering or in recovery from substance abuse disorders. So we're supposed to be jolly, be merry. A lot of people, there's a lot of alcohol usually around the holidays. So how can individuals in recovery or those suffering from alcohol or substance abuse disorders navigate these situations? I'll open that up to anyone.
That's a tough one. That's when it's time to lean on organizations like AA and Al-Anon. When you have more self-awareness and get people around you to support you, and maybe not be around people that are drinking and being merry. Maybe the friends that you have that aren't, that know that you are in recovery and it makes you uncomfortable. Just don't put yourself in situations like that, which is tough. Same thing with family members who do that. Sometimes it's time to go out and take a walk and maybe not come back if that's something that's threatening your sobriety.
I would agree with that. I would think it's important for you to know yourself. You know yourself better than anyone else. And keep in mind that you are human. So perfection is not necessarily the goal. Progress is. And with that being said, knowing your strengths and knowing your challenges, knowing what that looks like overall and what those triggers are. If you're upfront about what that is that irritates you or aggravates you, then you can be more mindful of when it's happening. So if you feel like on a scale of 1 to 10, when you're getting about a 3 when you're interacting with Uncle Joe, then it's time to step away, as opposed to waiting until you get to a 10 and then there's an awkward moment. So just kind of knowing what that looks like for you, knowing what those topics of trigger are, whether it's work or whether someone's talking about weight or your diet or whatever that looks like in your home, you know your triggers and everyone is different. So being aware of what that looks like, setting those boundaries, absolutely okay to set boundaries with your family or with your coworkers or whoever that is that you tend to have a more stressful interaction with. But it's completely okay to set those boundaries, and it's okay to recognize that the people you're setting boundaries with, they may not be in the process where you are feeling in that maybe their capacity. So set the boundaries and remember that you can control your reaction and not anyone else's, and then that will help you remove yourself from the situation if needed.
And
I
our
would also, oh, go ahead, dear.
I was going to say, in our surveys of the public around stress at the holidays, 19% of our respondents told us that food or eating caused stress at the holidays, and 10% said being around alcohol. So first of all, you're not alone if this is an area that's challenging for you. Anywhere from 10 to 20% of the people around you may also be struggling with either substance or food, which tends to be in abundance. And if you know that and you have some control over particular situations, perhaps introduce to your group, let's do mocktails. If alcohol is a challenge, make it something different and fun for people to try and invite them to join you where you're at. May make a little bit of a difference. Not all groups are going to be open to that. And if you need to set your boundaries, set your boundaries. But if there's a way to invite people to a different way of experiencing some fun and joy that fits more in with your needs, that's a great thing to do as well, because you may be broadening your support beyond the holidays if you can challenge people to think differently about how they celebrate and what the expectations are for everyone. So I think that's an important thing to consider as well.
One thing I will add is just a voice of challenge to say, don't believe the lie that when you're living a sober and you're striving and working in that it's Christmas, so it makes it okay for me to go have what I want when I want because I deserve it. See, drinking and any substance abuse isn't about deserving or not deserving. You deserve a life of sobriety and health. That is what is deserving. So there's just that we love to use the holidays for excuses. Well, so I'm going to have that extra cookie, or I'm going to have this. I deserve it. It's the holidays. And so looking at that mindset to say, number one, it's not worth relapsing into something that you've worked really hard to become free of and to be healthier. But number two, the whole concept of deserving with it when it comes to alcohol, I just challenge that thought to say, no, you deserve to be healthy. You deserve to be free from that bondage of how that has wounded you in the past, and to run from it, just run from that. And in a time where everything is steeped in tradition, you may have to be bold to say, I'm starting with new traditions because my life and my choices don't fit this tradition anymore. And to give you that freedom that's okay to write your own new traditions this year.
That's really powerful to say. I think the word tradition has a generally positive, connotation to it. Like we've had traditions in our families for years to do this, but if they don't serve you or you don't find value in them or they provide stress or any of those things, then I think that's great that you advocate for creating your own traditions. That's wonderful. Our next question is about how entering social settings where varying opinions and beliefs are present can be uncomfortable. It happens all the time, but generally I feel like during the holidays we're gathering more. So uncomfortable topics or conversations can be brought up more frequently, and they're hard to navigate. Do you have any suggestions? We'll start with Lynn on how individuals can navigate these situations to ensure they're prioritizing their mental health and they're not being put in situations where they feel helpless.
Yeah, I mean, this can be really a tough situation, right? You may really value and pride being an ally for certain populations or really paying attention to certain kinds of issues, and not everyone in your circle is on the same page as you. And you may feel torn to wanting to really stand up for and encourage others to consider their beliefs and what they're thinking about, yet at the same time, that may feel very challenging, or you may simply not want to, disrupt how things are happening. So I think it's important to, if you anticipate that that's a possibility, think about the situation that you'll be in, what values are most important for you to uphold, how you want to behave in that situation, maybe even plan some outs. If for some reason you feel that you are less likely to be included, or are perhaps the person, you've got family members who maybe are not very sensitive or knowledgeable about mental health issues and say unkind, hurtful, or demeaning things, and you don't necessarily want to confront at the holidays, maybe you can identify a partner in the group that's going to be there with you who will be able to say, hey, Lynn, let's go out for a walk now. Let's take a break. Let's head on out if things get heavy. You can plan for doing something like that, or letting somebody that you trust know about what some of your concerns are in advance so that they can check in with you if you feel like you potentially will be in that situation. At the same time, others may feel that they really need to express their point of view and have those tough conversations, and they don't always get to speak with certain family members unless they're in this kind of setting. Think about the overall situation that you're in, what your goal is for having a conversation. And we could spend hours on this topic about how to have these kinds of conversations. But think about what works for you. Nobody likes to be told you're wrong. And nobody wants to be made to feel ashamed or stupid for thinking particular ways. So go in thinking about that. And sometimes even just saying, I have a different point of view on that. Have you ever considered X? If you really want to dive into a more controversial topic, that may get you an entree far better than, no way, I can't believe you would possibly say that. Don't you know X, Y, and Z? So it's important to think about how you're more receptive to new information that contradicts what's going on. And sometimes if that's really going to be important to you to have that kind of conversation in a social setting or a gathering, maybe practice ahead of time some things you might want to say. Practice always helps us find the words. Most of us come up with the great way of framing a topic 15 minutes after the opportunity happened, not in the moment. So practice can be a good way to do that. No matter how skillful you are verbally, thinking ahead can often provide us with some strategies there.
And if it's predictable, this is going to happen every time your family gets together. One of the other things you can do is set it up ahead of time saying, I really don't want to argue this year. So let's take politics off the table.
Mhm.
We have so many other things we like to talk about, so many other things in common. Let's do that. And that's kind of what we've done. And it's so much more peaceful and a lot more fun.
Another thing you can do is, if you do run into a situation where there is a person who is trying to have a conversation that you're not comfortable with, you can always give the response to the question that you would prefer them to ask. And they will obviously be kind of thrown off, but that allows you to redirect the conversation if you're not as comfortable with the direct method.
Those are wonderful.
And I was going to say, if it's hard to say we're not going to have the conversation, I have a colleague who posts a sign on her front door that says, we're not talking about this, or this at Thanksgiving dinner this year. And she said this year she forgot to post the sign and it didn't go as smoothly. So the sign really has made a difference in her household. You'd be surprised to think that works, but it really can.
I love that idea.
We got a comment from one of our attendees that says, cultural and familial traditions may make it difficult for you to interact with your native or birth family. Recognize that the only person you can change is yourself. Incredibly wise, great advice. I think we all go in sometimes these conversations hoping to open people's eyes to your point of view or maybe change their opinion, but you really can only control yourself in this situation. So I think sometimes that helps set expectations and temper expectations. So thank you to the attendee who sent that. I appreciate that. I think there's also something to talk about a little bit in this point about your reaction to things. So if, let's say that someone maybe isn't respecting the boundaries that you set, they're talking about a conversation that you were like, I'm not interested in talking about politics. Let's say that's an easy one, but they won't really respect kind of those wishes. How do you try to control your reaction to things like that? Are there any tips that you can take to kind of make sure that you're not giving into this person's kind of wishes to pull these things out of you?
I would say every opportunity is an opportunity for self-evaluation. So with that being said, when people don't respect boundaries, it definitely says more about them as it does you. And when those boundaries are being pushed and when they are pushing and making you feel uncomfortable, it's an opportunity to kind of self-survey and determine if this is someone that you need in your circle or you desire to have in your circle. But also reflecting on that the person you're having that interaction with, everyone has different life experiences. So there may be a past experience of trauma or stress that they've experienced that they haven't even acknowledged yet, maybe anxiety or depression. And these may just be symptoms being projected toward you. And so identifying and knowing internally how you want that relationship to be with that person and surveying yourself within and understanding that you cannot control any interaction except your own will allow you some freedom and just extend the person grace the way you would want someone to extend you grace when you're not in your best life.
Thank you. I appreciate that. Another question that we have is surrounding people who are struggling with medication effectiveness or medication simply not working. What advice would you give them about taking medications for anything, mental health in particular, during the holidays? Robin, we can start with you if that's okay.
Yes. Well, number one, if you're already on medication, don't start messing with it yourself. Talk to your provider and find out if there's something else you can do. Gene site testing is amazingly helpful. And when I'm about to put someone on an antidepressant, anxiolytic medication, getting the gene site test helps so much because it guides you on how they are metabolizing certain medications. So what gene site will give you is green light, yellow light, or red light, which medications would have the best odds of being helpful, which people will metabolize normally. If someone's a slow metabolizer, the medication may not work and they'll have side effects. If they metabolize them too quickly, then they may need more of the medication. So having a guide is amazing because when you see a person, you don't know, looking at them, which medication is going to help. So that's why genetically, if you know what they look like, it gives you a much better idea of what medication might be best. So having that test is, for me, has been amazing, life-changing for me and for patients, especially for when you're treating kids. I don't treat kids, but I would not want to mess with that. I would want to know what's going to help them and not try willy-nilly to figure out a medicine that's going to work.
I would definitely co-sign that with Robin. I believe that pediatrics, sometimes you don't have the grace of time. So, we largely rely on subjective information. So what the patient tells us in order to kind of figure out the best treatment plan that's going to be most efficacious for the patient. However, if the patient is a little person, they can't always express what they're experiencing. They're only mom and dad are going to be able to give us that information. But that little person is made up of two different people. So having some insight about what that genetic outline looks like so that we can best prepare a plan. And also with GeneSight, the benefit of it also is that if you do a GeneSight test for a pediatric patient as they grow, that will always be their property. So we can always retest when new updates come out, and it allows them to have the most updated information so that their provider can align them with the best alternatives.
And the nice thing about GeneSight is it's quick. Once you do the test, you get the results back really fast. So unless someone's, in a total crisis, you can wait a couple of days to start treatment, because that's all it usually takes to get the results.
And it's very insightful. I love that the GeneSight report provides colors. So green, yellow, and red, kind of giving us some insight as to where we can start. And just keep in mind that although it sounds like a traffic light, green, yellow, and red, the green does not mean that this medication is going to magically work. It essentially tells us, it gives us the best plan of action for that these medications should work as directed. However, there are other components like age, weight, multiple diagnoses, and other components that we take into consideration that may impact that. But the yellow column also tells us that if, as Len mentioned before, if that person has experienced some type of gene drug interaction, or there needs to be some type of adjustment in the dosages, it provides us with that information. And then red doesn't mean that it's off the table. It simply means that we need to be a little bit more cautious, take a little bit more direction with those dosages and considerations.
Absolutely. Yeah, I totally agree with that.
Thank you guys for bringing that up. For any of the attendees who are interested in learning more about GeneSight, you can go to www.genesight.com. That's GeneSight.com. Again, it's just a genetic test that these providers are talking about that they utilize to help manage medications for patients. So I think the fact that we've talked too about that there is seasonal affective disorder that can happen as early as August, and it really highlights the importance of getting patients on a stable medication regimen kind of leading up to that holiday time. Do you guys feel like you try to maintain patients on their regimen during that time? Do you see a lot of switches? Does it look any different during the holidays?
I would say that I see a lot of new patients. So a lot of initial intakes during this time, and that could be in relation to just this time of year, them being forced to kind of evaluate because they don't feel like their best selves. And a lot of times this time of year, people have always put their mental health on their list of things to do, kind of like starting a new gym membership, and they just kind of found their way into establishing. But also knowing that mental health care, sometimes there can be a waiting list and trying to find the right provider to fit. So all of those things in combination, I think, would contribute to an increased amount of patients for intake.
I would just add that it doesn't matter what month of the year, if there's a need, there should be some treatment, medication or not, if that's, the treatment regimen, but there needs to be treatment. And as my rule of thumb, I tend to be pretty cautious, knowing that stressors can be amplified this time of year, to have patients stopping their medications or suddenly withdrawing them, or even the risk of adding new medications, as that does carry risk. But no matter what, if that person is suffering and struggling, there needs to be an intervention no matter what. And most of the time it needs to have happened yesterday. By the time they either speak up to get help, maybe they've been suffering a while, or Whitney, as you said, wait times nationwide, healthcare providers and therapy. There's delays in access and a shortage. And so most of the time, by the time we're seeing them, the signs are late, the symptoms are there, and they've been there.
One of the things I'd really encourage people to do, if this describes you or somebody you care about, we know that we don't have enough providers. We know that it's hard to get access to care. But if you are the person who's struggling, enlist someone to help you in your network. If you know someone who's struggling, offer to be that person. Because when we're struggling with emotional or mental challenges, if we're struggling with substance use, we often don't have the energy or the motivation to go out there and try to find the help we need. So if you can be that person for someone you care about, you have done somebody you've given them a gift to help filter through possible contacts and phone calls and to think through what might be needed. Because it's very hard when you're feeling depressed, you don't have motivation, you're not interested in doing anything, and it's hard to get moving on it. So I really encourage people to consider whether they can either enlist the help for somebody for themselves or be that person for someone else.
I agree with that. I would also say, just while we have the opportunity, that you or anyone you know is experiencing thoughts of wanting to harm yourself or anyone else, please stop what you're doing and go to your nearest emergency room. There are also other alternatives for people who are struggling in crisis. There is 988 is the crisis hotline, and then even for veterans, you can also text 838-255 if you're in crisis as well. But I definitely want to encourage you, if you haven't established care or treatment and you're looking for someone and called and you can't find anyone, other alternatives are to call the number on the back of your insurance card. They'll tell you who's in network with you, and you can always reach out.
Wonderful. Thank you all. This is great advice. We have a few questions from the audience. There's quite a few related to the GeneSight test. So just again, kind of a holistic overview of what this test is. It's a buccal swab, and it's a genetic test that looks at how your genes may affect your response or metabolism to certain medications treating mental health. So again, I would recommend going to the genesight.com website. There's a plethora of information there we can help connect you with. We did get a question about if providers automatically do genetic testing on their patients. I can speak from a scientific perspective that our clinical trials show that patients who have failed at least one medication are ones that have shown to have benefit clinically. I think every provider may have a different answer if anyone wants to kind of respond to that question a little bit.
Yes, I think it depends on the area you're in, whether people are open to doing the GeneSight test. In our area, more and more people are doing it. But then there's other areas where people are they don't necessarily want to do it, don't do it. But there are providers, I think almost everywhere, that you can find, that GeneSight can help you find if that's something you want to do. And it's easy. You can even do it yourself and send it in, but a provider has to order it.
Yes, and that also includes, you giving your consent. So you can't just order it without your consent as well.
Right.
We order labs and things of that nature, but it does require your consent, so you would be aware of it in advance. And then keep in mind that sometimes I just like to take the opportunity to dispel any myths about DNA as it pertains to GeneSight. They destroy your DNA after the test is run. They don't sell it off or utilize it for any other benefit.
Thank you, guys. Some great comments. I'm just going to read out loud, answering a question about what are things that we can do to bring forward a responsive framework rather than a reactive frame of mind. So do pre-work and preparation to set yourself up for success. Engage in some activities that will put you in a better framework before interacting with people. Mindfulness, meditation, journaling, self-care rituals. Put together a WRAP, that's an acronym, Wellness Recovery Action Plan, or Psychiatric Advance Directive. Can be very empowering and supportive. These are wonderful recommendations. Thank you. I think these are very helpful. One thing that we haven't touched on yet that I think is really important to discuss, though, during the holidays is that not everyone celebrates traditional American holidays. So we talk about Christmas as if everyone in the world celebrates it, but that's not always the case. So for those who don't, that may lead to feelings of exclusion. So how do we handle that? How do we manage that? Lynn, do you want to start with that one?
Yeah, it was particularly striking to us in our recent survey of stress at the holidays that at least 10% of people who responded to our survey said these holidays aren't my holidays. So they not only feel not part of or potentially feel they can't participate in some of the activities others might be participating in, they also may feel uncomfortable or unsafe celebrating their holidays. And this is particularly true in right now where we see a lot of anti-Semitism and anti-Arab feeling. So holidays that may be celebrated around this time of year, people may be quiet about it because they don't want to draw attention to factors about themselves that perhaps mark them as different or perhaps make them vulnerable, which is really unfortunate because the holidays that many religions around the world celebrate in the darker months of the year have to do with light and have to do with defeating the bad and good triumphing in many different ways. I realize that it's not the theological meaning of Christmas, but that is an aspect, a component of what's happening. The same is true with Diwali, which is a Hindu ceremony. The same is true with Hanukkah and the gift of how the oil lasted for so long. There's an element of light and of continued rejoicing in the world. So I think for those of us who may celebrate traditional holidays, recognizing that not everyone around us may be part of that and trying to be more cognizant of that so that we're not intentionally excluding someone. People don't like to have their names mispronounced. They don't like to be assumed to be something they're not. It's just a very simple way of recognizing human differences and being comfortable with it. So that's the first thing. The next thing that I would encourage people to think about is, are there ways to connect with people who maybe don't celebrate the same holidays as you do. That's not about holidays, but might be about human connection and joy, and giving people space to just gather and celebrate the fact that we're on the same planet and we're marching in the same direction and hoping for good in the world in whatever way that is. So I think being more open to that and being more cognizant of that. The people who are in the driver's seat around the holidays, in terms of those who celebrate Christmas, could do a nice service to those who don't by recognizing, slowing down, and calling in everyone's experience of a time of year of good wishes. All of us are hoping for good in the new year. And so that can be a nice way to acknowledge one another. But I think that's important to recognize that there's both experiences of feeling left out or excluded. And for this year in particular, there's also feelings of some fear around, can I be targeted for the kinds of holidays that I do celebrate? So I think it's really important to pay attention to that right now.
Thank you. Any other comments?
I just wanted to add, I think that was stated very beautifully. I agree with that wholeheartedly. And people just want to feel accepted and loved and supported. And that just kind of goes back to make sure that you are treating people the way you want to be treated.
I couldn't agree more. And I think this lends itself nicely to our last question here. To close, I was just going to ask our panelists to share any final thoughts or advice or anything that you really want to emphasize to the audience about how they can work towards a more healthy holiday season. So I know we've talked about a lot of great things, but Elizabeth, do you want to start with just kind of your final parting words?
I would say the challenge is to quit siloing mental health away from our other physical health aspects and prioritize our minds just like we would prioritize the painful gout in my big toe. And in medicine, we talk about preventative health care. How do I prevent, developing type 2 diabetes? How do I prevent another heart attack? So let's talk about how I can prevent changes and declining or struggles in my mental health. What are some preventative measures that I can take to manage my anxiety, to prevent this from happening yet again? It's Christmas. It's, whatever we'll say to ourselves. So acknowledging and putting mental health and wellness on the same playing field as we will put and prioritize other aspects of our physical health. And what I like to say is our heads are attached to the rest of our body, and we need to treat it that way.
Thank you. Robin, what about you?
Well, I think usually our harshest critic is ourselves. So my advice is to be kind to yourself, treat yourself well, eat healthy, exercise, meditate, take walks, and make yourself the priority.
Thank you. Whitney?
I love that. I would say that, as Robin said, being the priority means that you are always putting yourself first and considering other things as alternatives, but knowing that healing is not linear. So what your journey looks like may be different for someone else. So focus on you, focus on what you need.
Thank you. And Lynn?
And my co-panelists have all said fabulous things. I think it's important to note that taking care of ourselves is not a selfish thing. I think all of us learned during the pandemic, heard the expression, put your own mask on first before you're going to help someone else. And that is so true, that we need to take care of ourselves in order to be there for others. But I think another thing that's important to think about too is as ideally all of us are learning more and more about ourselves, when we recognize that we're feeling distressed or overwhelmed, use that as an opportunity to check in with yourself and figure out, have I put some expectations on myself that don't need to be there? Or am I responding to somebody else's expectations that aren't really consistent with what is important to me? Are there things that I can let go of at this time of year? It's quite true that children really don't care that much about perfect icing on cookies or the most neatly wrapped gifts. My child has always said he loves having time with family and food. Those are the things that he really particularly likes at the holidays. So that's what we try to emphasize. And so if you think about what's important to you and the people you care about and put your emphasis on those things first, that hopefully will amplify your joy and also give you and your family or your friends and your community permission to let go of the things that are less essential and are not the top priorities for your circle.
Such insightful words. Thank you all so much. We have a few comments from the audience I think are great as well. Be kind to everyone, treat them the way you want to be treated. A functional, integrative mind-body health approach is imperative. I agree with all of these things. So thank you for your time, for the panelists. Thank you for the participants for joining. We appreciate your time. We know it is valuable, and we hope you gain some good insights into how to have a happier holidays. So thank you everyone so much, and have a wonderful rest of your day.
You too.